I'm Matt Willis, Public Health Officer for Marin County, with a message for May 26th. Recent studies have shown that life expectancy, that is, the average number of years people can expect to live, has decreased in the United States over the course of the pandemic, and that many of those excess COVID-19 deaths would have been prevented had higher vaccination rates been achieved nationally. In Marin, our data shows that we were protected from that effect and did not see a significant reduction in overall life expectancy, despite having an older population. This is yet another benefit of being among the most highly vaccinated communities. But as we pivot from a focus on the pandemic, I want to describe what we do see in our local life expectancy data, because there are other concerning patterns that require attention. In public health, life expectancy or longevity is helpful for us because it describes the sum of so many factors contributing to overall health for a population or a group. This is why the Robert Wood Johnson Foundation, in their annual county health rankings, uses county-level life expectancy as the main metric for ranking the health of counties and comparing them. And Marin has been ranked the healthiest county in the state of California 13 of the past 14 years. Marin residents' average life expectancy is 85.2 years, nearly a decade longer than the national average, which has now decreased to 76.4 years. Our community is known for longevity, and there's a lot to celebrate there. But as we build on our strengths, we also need to look beneath the surface, because while we have the highest average length of life, we also have among the widest ranges around that value. In fact, there's a 15-year difference in life expectancy between communities in Marin, specifically between Sausalito at 92 years and Marin City at 77 years. What's even more striking is that these two communities with the longest and shortest life expectancy in Marin are connected and are 1 mile apart. Shortened life expectancy is especially troubling when we see what's possible, what's attainable, so close by. To close these gaps in life expectancy, we in public health look closely at the diseases that contribute to premature mortality. And we see a very clear pattern in Marin. The leading causes of preventable death in our low-income communities are cardiovascular, mainly heart disease. This understanding is critical because it means the highest yield strategies for narrowing these gaps are in promoting heart health. Our strategies, which we're pursuing in the same collaborative approach we took to the pandemic response, fall into 3 areas. The first is working with communities to increase opportunities for healthy eating and active living at every stage of life. Because one of the clearest connections between poverty and heart disease is around diet, affordability of heart health foods, and opportunities for physical activity. The second critical strategy is ensuring access to high-quality health care, especially primary care, for screening and effective management of risk for conditions like diabetes and high blood pressure that contribute to heart disease risk. The last strategy is further upstream and acknowledges the deeper social determinants of health. Marin City is one of the most diverse communities, not only in Marin, but in California. The community of Marin City is about 1/4 African American, 1/4 Latinx, 1/4 white residents, and then a mix of other groups. In fact, it's in the 99th percentile of the most diverse communities in the state. Sausalito, by contrast, is nearly 90% white. In a nation and a county where race and opportunity have been so closely linked for so long, it's not surprising to find health disparities track closely with race. Average household income in Marin City is also about 1/3 what it is in Sausalito. This is why conversations about racial equity, economic equity, and health equity are inseparable, and tackling them together is critical. We also need to recognize that financial insecurity and prolonged exposure to race-based stresses affects both physical and mental health, and it can increase risk for cardiovascular disease, mental health disorders, and mortality. We've created a public dashboard to share the life expectancy data that we're using to guide our equity strategies with you. And you can use this dashboard on our website to learn more about the health of Marin residents by community. You can even type in your address into this interactive map to see life expectancy where you live. Our pandemic response showed us that when any community is left behind, we all suffer. Our goal in public health is to carry that understanding and the structures we built to support disadvantaged communities into the future, to tackle long-standing inequities and narrow gaps in life expectancy. Thank you for doing your part.